Hi everyone, so my name is Jinane Benajiba and I'm happy to be here today alongside with my colleague Bastian Beckers to discuss with you a topic which is of great importance today in the healthcare industry, which is all about the power of data insights and their impact on the quality and risk management. And we will show you as well how our company ANTEVIS is actually using historical data from medical malpractice claims to improve the quality and risk management, and how we do create a tangible impact on patient outcomes and as well on the overall efficiency within the healthcare ecosystem. We will as well explore the potential and some use cases of data for risk management and follow with a discussion on the future of data exchange. So, as we all know, and nowadays, and as it was already mentioned in the very beginning today, the availability of a huge amount of data presents both a challenge and also an opportunity. And at ANTEVIS, we do take this opportunity by analyzing some complex data sets to really create valuable insights and valuable patterns and trends. So, our goal is to actually turn extracted data into a knowledge, actionable knowledge, and in order to empower healthcare organizations to deliver some higher standards and also effectively manage the risks. So some quick facts about our company. We are a newly launched company. We are 3 years old now. We are also a result of a joint collaboration between two industry leaders, Actineo, specialized in bodily injury management, and a French insurer specialized in medical liability. We have started our operations first in Spain and in Italy in 2021, and since 2022 we are also present in Germany. We have our headquarters in France, in Lyon, and we also have our branches here in Germany, in Cologne, and as well in Italy, in Milano, and in Spain, in Barcelona. We are very proud of our international and very diverse team, which is composed of more than 35 professionals with very different backgrounds, and with all of them with medical background. So this includes our data extraction team, which is as well in charge of medical codification, and as well our medical team, which is mainly composed of medical experts from different specialties. Yeah, so since the beginning of our operations, we have handled more than 22,000 claims, including 19,000 data extractions and 9,500 medical evaluations. So what we are basically doing is extracting data from medical liability claims that we do receive from our customers. We organize and structure this data, offering as well medical evaluations of these claims. But at the end, we do have a lot of data that we try to work with in order to give some recommendations and also come up with some models. So what if you are if you are reading some news articles nowadays, you will probably hear a lot about the significant impact that data can have on healthcare organizations, and what we've been discussing this morning as well. So you will definitely find some articles about AI supporting surgeries, medication prescriptions done by AI solutions, articles also stating that medical decision making is nowadays supported by AI. So this all shows how much it is important today to collect the right data and find also the good use of this data to not only enhance processes within insurances, but also within the healthcare organizations. So one of the key benefits of data is to streamline processes, as we have said, also improve efficiency and provide better and more personalized care to patients. So, and by analyzing the data and using AI algorithms, we definitely can somehow unlock the full potential of data driven health, full potential, of data-driven healthcare, and which can definitely result in a very positive impact within the healthcare ecosystem.
Yeah, thanks a lot, Jinane, for the short introduction and also the few words about ANTEVIS. Maybe to go a bit more into details on which side we are a service provider currently mainly for the insurance sector. That means that we are really working with insurance companies in the different countries for medical liability claims. But as we are doing so, we are also very close to the clients of our clients. Again, that means to the hospitals and to the physicians who are insured by the insurances. And this is why our approach is also now addressing what we are having in terms of data directly to hospital groups and, for example, to physicians as well, to help them improving their processes and optimizing their processes, mainly in the field of risk management, because this is also what actually our direct clients, the insurances, want to have, to mitigate risks and to mitigate also the financial impacts of claims. So we are really coming from the other side, I would say, from the mistakes and the errors, potential errors that have been made in the healthcare, in the medical treatments that have taken place. And one of the key topics or the big reasons why it is so difficult actually nowadays to have the correct and the good and the structured data is that there is no good process to have this data extracted and structured without having any kind of additional manual completion. There are no really good systems who can work with this huge amount of data that we actually find in the healthcare industry. Automated systems, automated processes that allow us to extract the relevant data and to structure it and normalize it. We are working with files, as you can imagine, in medical malpractice that are enormous. So we are talking about claims reports that we have starting from 30 pages, going up to 35,000 pages, full of information, full of medical information, full of legal information as well, because we are always starting actually with the patient complaints, and then we see what has happened during the medical treatment, what went wrong, if there is a potential error in there or not. And this is why, besides doing this data extraction right now, we are also working a lot on how to automatize actually the extraction of medical data from medical reports. And we've just launched a service which is called Intelligent Document Navigator, which allows us to detect information directly in medical reports, classify documents, and extract the relevant data in the corresponding fields in our medical extraction software, so that we can more easily access the data and work with it afterwards. So we are actually, when having these claims in-house from our insurance clients, extracting plenty and plenty of information for each claim that we are receiving. So you have seen 22,000 claims in total. We are having in between 500 to 1,500 data points that we are extracting, always focusing on the complaints, so coming from the mistakes and then going backwards to what has actually happened during the medical treatment. Most important for us, for sure, are diagnosis, are medical interventions such as surgeries, such as procedures that have taken place during the medical treatment, as well as medication that has been prescribed, because we can codify this information. We are doing ICD-10 codification for the diagnosis. We are also doing the country-specific codification for surgeries, for example, and we are also doing the codification of medication afterwards, because we want to have the data normalized and structured in a way that we can then afterwards use it again. As we are coming from the claims side, the claims that we are receiving, we always have the patient consent form that we can actually work with the data afterwards, but all the data that we are having is for sure anonymized. So if we are trying to work with the data, elaborate what's going in there, this means that this is anonymized data in our databases that we are using. To give you a small idea of what we can already do after 2.5 years of operations, and this is really superficial, I would say, so it's on the top of what we intend to do, but it also shows really a short part of what we are already doing on top of that. So we are working with 5 clients now in the 5 insurances in the different countries. We are trying for sure to compare the different ways of proceeding and to do medical treatments in the different countries. And we are also trying to normalize the data in a way from the different countries that we can compare them afterwards and do kinds of benchmarking. And here we see, so this is already something that we provide to our clients within the insurance sector, their own organizations, let's say, or their own clients. We can monitor, for example, how many errors have been detected for a specialty within an organization in this specific organization. As we are coming from the claim side, as I said, we can also see when most of the errors actually take place in medical treatments during the year. Here we have a comparison between France and Spain, and we can already detect small differences in the countries. For sure, we do not have all the information, but we can also do a kind of forecast with the information that we have, because we already have a potential high amount of data and a high amount of claims from the different markets. This is just another visualization, I would say, from for the errors per specialty, but we can also do this kind of benchmarking in percentages, but also in total numbers. So compared one organization with another, compared one organization in France with an organization in Spain, with similar information about the hospital, about the physician's practice and so on, we can monitor actually where the errors take place. What we can also do, and this is one of our key expertises, I would say, is to detect where the mistake came from. So we have different levels, we have different categories in which we are categorizing the errors afterwards, and this is done by our medical team, our medical experts. And then they try to identify actually if it was on the care team level, if it was on a management or organizational level where the error happened, if it was on a patient level, or if it was on a process level and so on, or probably the physician's level because the surgery was not operated technically correct, I would say. But here you can already see, and this is not surprising actually, not for us and not for our medical team, that a lot of errors already happen on the patient level. This means patients who actually decide to leave the hospital against the recommendation of the physician or the doctor, or because of pre-existing conditions that had a major influence and impact on the medical error that has happened afterwards. So this is just the information from one specific organization here, for which we have already done a couple of data extractions and medical evaluations, but we can do this and actually organize this for any kind of organization that we have in our database already. We can also detect complications during our data extraction process and with our medical evaluation team, and we can also see actually how many complications are caused by a procedure or by a surgery. Because in our data extraction process, we are already linking information to each other. This is anything of data analysis has taken place at this stage, but just because our software is capable to do that, and we are linking and putting the data together with triggers. For example, a surgery was triggered by a diagnosis or by a pre-existing condition, or a medication was triggered by a specific diagnosis. We can link this data and already can do this kind of dashboards here. And this is the last thing that I just wanted to show in terms of medical data. I would say what we can do also, as we are working and extracting with all the potential data that we can see, medical data, we can also see how pre-existing conditions influence the medical malpractice or the errors that have taken place and how often they actually occur. And we can put them in percentages, and you can see below the codes actually for the different diagnoses that we have identified so far based on the data that we have extracted. The idea behind is actually to do a kind of root cause analysis. Maybe this is a term that is with which you are also familiar, but to actually see what has happened during the medical treatment, coming from the complaint and going back to the beginning, to the initial reason for the patient going to the hospital, for example. This is valuable for our clients, so for the insurances, because they can also better organize their internal risk management and working together with the hospitals directly, but also interesting for us in the future, directly cooperating, for example, with hospitals to see where actually the error occurred and why. This is just an example also from our database. So we have gonatrosis here, the ICD codification. We have seen there were plenty of procedures that have been performed with this coding, actually the replacement of the knee joint. And these are only two possibilities from everything that we have. I think just for gonatrosis, we have seen that there were 20, 25 different procedures that have taken place just from the claims that we have seen. And resulting from this kind of procedure, we have seen that, again, different complications happened. Complications are normal, they can happen. Some complications shouldn't happen. And for example, below we have an infection coded with P84.4 that has happened during the surgery. Or above, there was a problem in the care after the surgery that has taken place. And the people in the hospital, they have tried to correct it afterwards with another procedure that has taken place, but which then by the end actually resulted in the grievance of the patient stating, okay, this complication should not have taken place or should not have happened, or this infection should not have happened after all. And what we are doing, we are actually asking the questions, okay, what medical measures were taken after the initial admission of the patient, because we have this information, what was the initial diagnosis, why the patient came to the hospital or to the physician, what kind of complications occurred, and what follow-up measures were taken to mitigate actually the outcome of this complication. Was there any sequel afterwards? And this is just one very simple pathway that we are taking to analyze it. And we are going back from the infection that we have seen from this gonatrosis. We are going back all the way, all the steps that the patient has taken during his medical journey to understand where were the trigger points of this complication, where were the trigger points of this medical error that has happened. And what we can do with this actually, and this is the idea that we have already integrated partly in our systems, to give alerts for now to the loss adjuster, for example, of the insurance if they've received a claim in the very beginning, to say, look, we have a possible mistake here. This is a complication that has happened in the follow-up, and if the treatment is still ongoing, pay attention, because if not the right process is followed, there will be more complications coming after all. We can also detect the errors in the medical treatment from the past, and we try to analyze actually the procedures that have taken place, to say, okay, these were the good practices, the best practices, these were the practices which were not so good. And just also to give you an idea, the 22,000 claims that we have handled already are not only claims ongoing, so live claims, but we are also working with really historical data, so claims from 2010, 2012. So we are also digitalizing older claims to better understand what has happened. And we detect similar errors. So we can say, for example, already, if we have a claim coming in and we have a patient with a certain condition, as we have already heard, there are plenty of conditions that have an influence on how the person reacts on a specific diagnosis, or what kind of medical treatment is the right one for this specific person. We are also detecting actually the personal condition of the person, and then put it together with some medical information that we have, such as the pre-existing condition of the patient, to then say, okay, this person, we already had it in our database. We have seen in the past these procedures have been performed, these medications were given, and this actually led to this problem after all. For now, this is good for our insurance customers again, because they can then directly see in their own claim sending process, okay, if it was this case in the past and we have this similar case, okay, let's see if it's actually the same pathway. But the idea is to be in front, to be, again, even earlier in the process, and to avoid, if a patient comes with a certain condition, to say, okay, this is the good and this is the best practice, probably.
So, yeah, how do we actually see the collaboration in the future, not only from a data perspective, but also how to connect the different key players within the healthcare ecosystem? So we actually have the hospitals. So the idea is how to connect the hospitals, physicians, and insurances, and also the patients from another side. Sorry. Yeah, and to give a short outlook regarding the AI models to come, and regarding how risk management and quality management could look like in the future, we have already started thinking about developing some alerts, for example, as it was mentioned by Bastian. We have thought about some automated intelligence alert that could be sent to the insurances or the healthcare organizations, also the medical triage, which is kind of a basic triage based on some specific criteria, for example, and also some intelligent optimized medical treatments. And we have also found codes which somehow validate our approach, saying the real healthcare occurs outside of the doctor's office and hospitals, not when the patient shows up to make a complaint once their symptoms have already developed. Thank you.